The menstrual cycle is a natural biological process that happens in the female body. It's all about preparing your body for the possibility of pregnancy. Think of it like a monthly cycle controlled by hormones that gets your uterus ready for a fertilized egg. It's a sign of good health and a normal part of being a woman. We often talk about the menstrual cycle in terms of a 28-day period, but this can vary from person to person. Some women have shorter cycles, some have longer ones, and that's perfectly okay. The first day of your period, when you start bleeding, is considered day one of your cycle. This cycle starts during puberty, usually between the ages of 8 and 15, and continues until menopause, which typically occurs in a woman's late 40s or 50s. It's important to remember that every woman's cycle is unique, just like her body. Your menstrual cycle has four main phases: the menstrual phase, the follicular phase, ovulation, and the luteal phase. Each phase is marked by specific hormonal changes and events in your ovaries and uterus. First, the menstrual phase is what we often refer to as your period. It's when your uterus sheds its lining and you experience bleeding. This phase usually lasts between 3 to 7 days. Next comes the follicular phase. This phase is characterized by the growth of follicles in your ovaries. Each follicle contains an egg, and usually one follicle will become dominant and release a mature egg. This phase can last anywhere from 10 to 16 days. Ovulation is the exciting part. This is when the mature egg is released from the ovary into the fallopian tube. It typically happens around the midpoint of your cycle. Finally, we have the luteal phase. After ovulation, the ruptured follicle develops into a structure called the corpus luteum, which releases hormones to prepare the uterus for a possible pregnancy. This phase usually lasts about 14 days. Many women experience a variety of symptoms throughout their menstrual cycle. These symptoms can range from mild to severe, and they're all perfectly normal. During your period, you might experience cramps, bloating, tender breasts, and mood swings. These symptoms are caused by the hormones prostaglandins, which trigger the uterus to contract and shed its lining. In the follicular phase, you may notice increased energy levels, clearer skin, and a heightened sense of smell. These changes are due to rising estrogen levels in your body. Ovulation can bring about Mittelschmerz, a slight pain or twinge in your lower abdomen. Some women also experience a slight increase in vaginal discharge and basal body temperature during ovulation. The luteal phase is often associated with premenstrual syndrome, or PMS, which can cause symptoms like bloating, fatigue, irritability, and food cravings. These symptoms are attributed to the fluctuating levels of estrogen and progesterone. Managing your menstrual cycle doesn't have to be difficult. There are plenty of simple, practical tips that can help alleviate symptoms and make your period a more comfortable experience. One of the easiest things you can do is track your cycle. By noting the first day of your period each month, you can start to understand your unique cycle patterns and predict when to expect your period. Exercise is another great way to manage menstrual symptoms. Regular physical activity can help reduce cramps, boost your mood, and improve overall well-being. Diet plays a crucial role in menstrual health. Eating a balanced diet rich in fruits, vegetables, and whole grains can help regulate hormones and reduce inflammation. Staying hydrated by drinking plenty of water is also important. Over-the-counter pain relievers like ibuprofen or naproxen can be lifesavers when it comes to cramps. If your symptoms are severe, don't hesitate to reach out to your doctor to discuss other treatment options.